Good afternoon, everyone. This is Michael from Medesk. I'm going to be your host for today for our webinar. I just want to check that you can all see me and hear me and also see the slides moving back and forth. So if you'd like to use that as an excuse to introduce yourself in the chat, that would be great. Once we've done that, we can safely make a start. Excellent. Thanks very much, Eva. Hello to you as well. We'll just wait for a couple more replies just to make sure everyone is in the same boat, in the best sense of the phrase. And we can go. Perfect. Thanks very much, Elaine. Yeah, thanks, Stephanie. Thanks, County Physio. Sound seems a bit crackly, though. My microphone isn't reporting any issues, but if that does continue, please do let me know again. Let me see. Yeah, I mean, sometimes the crackliness can be associated with a poor internet connection. It might be the case if you're on a phone, for example, or might be far away from the Wi-Fi. I can't see any problems on my end, and other people are reporting sound to be fine. So we'll proceed as we are. If it becomes untenable for you to continue watching, we will be sending out some recordings of the webinar and some additional materials afterwards anyway, so you won't stand to lose out. All right, thanks so much, everyone. So my colleague, Christine, will be here manning the chat. So she's responsible usually for presenting Medesk to interested parties. And so she will point out a few things that I might have missed as we go along. And she's got a few words to say at the end just to introduce Medesk a bit more, whereas I'm going to focus more on running a clinic remotely in general, as well as using Medesk-specific examples. Okay, let's make a start then. So it's all about welcoming remote consultations as the new normal. So over the past 9 months, obviously, we've all had a pretty rough time of it. And one of the main things to come out of all this in terms of how healthcare is provided is that online consultations and essentially anything that's not in person has sort of jumped to the forefront of what people expect to receive. So even in the NHS, for example, patients are increasingly expecting to be offered a video consultation, even if the GPs are otherwise fully booked or can't see them. So that, of course, that trend does obviously go into private practice as well. And so we're going to discuss it today and really discuss some of the aspects around that and how you can make sure you're providing your remote consultations and everything that surrounds it in the correct way. Okay, so just to have a look at some of the challenges you might be facing, and then we're going to run through a couple of the advantages for both patients and yourselves for using remote consultations in the first place, and we can see whether any of those resonate with you. We'll take it from there. So some of the main challenges that my clients talk to me about, and some of the reasons why they end up using telemedicine or video consultations are these kind of things. So it's often a case of there being really very little other options. So it can be the case that there are all sorts of travel restrictions in place right now. I'm based in London. Obviously, the whole of the UK is under various stages of lockdown. And for me, it's very clear that even if people can travel, they're generally speaking not supposed to if they can get away with it. And of course, in many cases, they're not going to be willing to travel either, especially if you've got patients who are, maybe they are far away, maybe they're of limited mobility. They may have all sorts of different issues like social anxiety that may have worsened as a result of being in this sort of pandemic situation and not actually being able to challenge those kinds of anxieties like they might have previously have been doing. And of course, some of the other things that our clients have noticed is that actually it can be more convenient and cheaper for patients to have a video call, and they may well opt for this instead of coming in, especially if they don't have to. Some of the benefits that I've noticed that the clients of mine have noticed for themselves, specifically for themselves, so for the clinics and the physicians, is that first of all, it's very, very straightforward to do, especially when it's integrated into your existing workflows. It's very convenient. So actually, all you need to do really to generate a video link in all sorts of platforms, not just Medesk, is pretty much click a button and it generates a link. So I use Google Meet a lot of the time with my clients, and actually all I do to make a link for them is actually click a button as well. So we've built that kind of same functionality into Medesk. So you book an appointment, you click a link, and it creates it for you. Of course, all those kind of things are sent out automatically to patients. So the idea is that you're not having video consultations be some kind of big, massive problem on top of what you're already doing. It's actually, the idea is to kind of seamlessly intertwine everything together. And so what we do is we actually make sure that people get this information automatically. You don't have to do anything. Some of the other benefits we've looked at are actually being able to switch to video as a last-minute resort. So what we found is that some clinics, when they were having to close at short notice, or they were noticing people cancelling at short notice because they weren't going to be able to travel and so on, what we noticed is that if they were able to offer the patients a way to continue the booking and just do it online, just have that online consultation, they actually would often go for that instead of just outright cancelling and coming back later. So we were able to save, and on average, around I think it was around 79–80%, just shy of 80%, of all of the physical appointments that were going to happen were possible to convert to video or telephone, at least for the purpose of finding more out about the patient's problem, and then either having them come in anyway afterwards, or continuing with a remote approach. So it was possible at least to keep those people engaged to that level. And naturally, makes perfect sense that patients should be able to access any telemedicine tool straight from a portal or by a link, as we've kind of just discussed a little bit. So before I go into the nuts and bolts of how you can actually optimize all this to work for you instead of work against you, so it can actually be a beneficial thing to do, not just something you have to do or feel like you need to do, what I want to know is how many of you so far are running any kind of remote consultation service? So whether that's traditional phones or whether that's video, how many of you are actually doing that at the moment? And how many of you are here just because you're thinking about it? It just helped me be able to display and show the right level of information for the audience, really. Okay, so plenty of answers here coming through. So pretty much everyone has done phone, and most of you have done some video stuff as well. Cool. So that makes a lot of sense. You're obviously seeing the demand for that and reacting to that. That's good. So what I'm going to do then really now is not so much go through how to run a video consultation. You presumably are already up to speed with how you've changed the way you might engage with the patients in the consultation and so on. What I'm going to talk about more is how you actually get to that point in the most efficient way, how you can keep more people coming in that way, and you can actually then use remote consultations as a way to actually survive and even thrive in this particular situation we find ourselves in. So you won't have to worry so much. So what we look at as one of the primary means of acquiring patients online is through the online booking platform that we use. And there are various different strengths to that will help you not only get people into your clinic, but actually make sure that they're the right kind of patients for your services, and that you've done all your due diligence and you're making sure that that's a reliable source of patients for you. So we're just going to look through a few points like there. so you can understand maybe some of the things that you're missing out on, or maybe there's some of the things you're doing but you could be doing differently, and just really to get a bit of a thought process going. So one of the main things that we focus on is actually custom branding the online booking process. Now, the reason is because when patients are on your website, or looking at even your Facebook page or something, and then they are taken away to a third-party booking software, they feel that sort of disjunct between the two entities very, very severely. They may still book, but they can definitely feel that they're somewhere else that doesn't belong to the clinic, and it doesn't tend to create a very positive impression. So what we've essentially done is, on top of our normal booking process, we've enabled you the ability to put your own logos there, your own branding and colors and everything, so that if you were to put the booking platform inside your website, as if it's an inherent page of the website, the patients don't really notice the difference. They just assume it's all part and parcel of your website, which essentially it is, except the tool is made by us. So it's one of the ways that you can actually increase that kind of brand awareness and that continuity of the brand as you go through, which does increase the level of trust that people are going to have in you, especially if they've not been to you before. And one of the other things to do is that I find that often in medicine, even in the private sector, people aren't always as forward as they could be about promoting themselves as individuals, not just a practice, but as individuals. But what we've found is that the more you say about yourself, that's of course relevant, the more likely the person is to book with you, because they can understand what you stand for, they can see what you look like. That seems to count for a lot, and you can really make a nice first impression there. So before we continue with a few more points, what I'd like to know is how many of you at the moment are using any form of online booking? And if you are, what kind of format does that take? Is it a contact form? Do you allow sort of live availability to be shown rather? How does it work? Okay, Elaine says not at the moment. And so for those of you who don't at the moment, is it something that you want to do? Is there any particular reason why you don't? And I wonder whether I could address why that might be. Okay, so Beckington Physiotherapy uses a remote booking office. Stephanie Goodwin says too much chopping and changing of patients about timing. Yeah, so I mean, there's always going to be some degree of that if you're giving too much control to the patient. That is true. County Physio says, used to use a contact form, but not since COVID. Too much screening needed at the moment. You're going to enjoy one of my next slides then. I can tell you that. Stephanie says as well that we get them to call, as does Sarah. Yeah, so in terms of getting them to call, is that just because it's easier to gather the volume of information you'd need from the people, or is there any other reason for that? Otherwise, multiple emails about when they want to come. Okay. Yeah, I guess that makes sense. I mean, of course, when you give too much awareness to patients and clients as to when you're available, when you're not, you can sort of paint yourself into a corner a little bit. So what I'd say is that online booking is a very, very powerful tool for patient acquisition, but you have to be careful and make sure that what you're showing off as your availability is what you're genuinely able and willing to do. That's the only thing. What we often do in Medesk, for example, is we show certain time slots that are available and then just block the rest of the day for bookings that you're going to make for yourself. The idea being that you allow that flexibility to the patients when it's okay for you, and you prevent it when it's not something you'd be happy with, which means you can retain a high degree of control over your availability and your workload without actually the patients realizing that you're limiting them too much. They may just think that you're quite busy, which you probably are, of course, but they will see that in the best possible light. And so one of the things I wanted to look at as well is that not everyone is suitable for an online consultation. That's clear. I mean, if you're doing a very physical kind of a physical specialty that really requires examination, it requires physical manipulation of the patient in some way, naturally, online consultations are only going to be useful to a limited degree. For things like screening or checkups or that kind of thing. That makes perfect sense to me. But at the same time, what you want to do is make sure you get as many people in as possible that are suitable for online consultations. So what you can do with that is you can easily put an online booking form as part of your of the booking process itself. Just have a pop-up form with a few questions. Do you do this? Do you need this? Do you need that? Do you have this symptom, that symptom, and so on? And you can kind of triage people, validate them for your services as you go along. If it turns out that they're not suitable for online consultation, you can, of course, invite them to something that is, in person, or you can defer that appointment for later down the line, or even refer them to someone else. So it just enables you to get straight down to the point, understand who's suitable, who's not. And of course, as we were talking about a moment ago, there's a lot of screening involved because of COVID, as the folks at County Physio said, and of course we are attempting to focus on that as much as we can and make sure that the right questions are asked at the right time to ensure that people are, not attending physically if they've got coronavirus symptoms or they need to be self-isolating or so on. It's just one of those ways where you can, first of all, protect yourself, protect your patients, and everyone involved in the whole process. But at the same time, it's all about due diligence as well. You want to be seen to be making these checks. It's certainly a way where if someone is coronavirus positive, but they still need your help, there's nothing then stopping you from saying, well, look, you can't come in person, but we can talk about this over the phone or video. There's surely something I can do. So it's really what it really boils down to, I suppose, is not allowing yourself to lose opportunities just because of little factors like this, where you could still help someone, and it's not just it's not just a case of turning them away and having them come back later, or if at all. One of the main struggles that I notice people are having as well is because of the whole furlough situation, having to lay people off and all sorts of things like that, working with skeleton staff, it does mean that a lot of the slack has been taken up by clinicians. I don't know how you all have been experiencing that, but a lot of people who speak to me have certainly said that their management of paperwork has gone up and all sorts of things they've got to do that normally the admin team might do or help them with. They are doing themselves. So actually, we do use booking forms to kind of capture that information as well, capture things like consent, capture things like GP information and all stuff like that, just to help you make sure that when you have to create any documents or you have to provide any information to the patient, again, you've got everything to hand where you can just make the document in a matter of seconds, really. You've got everything you need. And one of the major things that we do as well is we don't just sort of allow patients to book straight in and then have a situation where you're inundated with patients who may or may not be suitable, but they've all got an appointment and they're clogging up your diary. That's not really what we want. So what we actually do is that when bookings come in through the Medesk online platform, you actually get a chance to verify and confirm them. So you can actually get back in touch with the person and say they're not suitable. You can see straight away from their answers to their questionnaire what's going on and whether they are suitable or not. And it just gives you that bit of a safety point there. And only after that, then the confirmations and reminders and all those kinds of automated tools can be set so that you don't get people thinking they're coming when they're not. And one of the major things that I've been talking about with my clients is the idea of online payment options. So, of course, when patients aren't coming in to see you physically, it does create a sort of disjunct between the ability to actually see people and then actually collect the funds that you're owed for those services. So, how many of you at the moment are collecting payments online? And if you're doing so, are you doing so before the appointment or are you doing it afterwards or even during? Hmm. Okay, so a range of responses here, really. Then most of you are using backs or card. Makes sense. Um, so a fair few are saying in advance of the appointment, or at least on the day. And I can see that Gina, you've just said that you now do actually ask beforehand. So it makes a lot of sense for a number of reasons. It's not always appropriate, of course, but there are lots of cases where it is. And some of the main reasons I come across on a daily basis as to why my clients have started doing this is because, firstly, when we're in such uncertain times, you have to be really careful about the business decisions you make, more so than ever. And one of those problems is overheads. So whether that's because you're hiring staff or whether it's because you're hiring a room, paying the electricity bill, whatever it might be, keeping the premises open at a time when people are supposed to be booking with you and supposed to be attending. So what happens if people don't turn up is that you then have essentially spent that overhead but have got no way to recoup it. So what we do with prepayments online is essentially we use that as a way to cover the overhead. So at least you break even. And also what it does is because telemedicine is quite a new thing for most of the public, even if they want it, a lot of people still have this kind of inherent view that it's not as valuable as a proper consultation, also, in-person consultation. Now, there's obviously some argument for this and some argument against it, but in principle, one of the main reasons why it's worth having some degree of prepayment involved is because paying for something in itself makes people think that it's worth paying for. So it's something of a quirk of human nature where if you get something for free, you kind of don't respect it. You kind of think, well, if it's free, it can't be worth very much. There is that perception, and it does bleed into healthcare as well. And actually, by charging even a nominal fee, you do actually stand the chance of increasing the likelihood of people attending the appointment just through that. One of the major things that I really did not really like when I was in practice, albeit in the NHS, was the idea that the doctor-patient relationship is transactional in some way. Now, it's of course obvious that you're providing a service and you're getting paid for it, as you should. But at the same time, it's often not the best way to go about it by sort of, seeing your patient and then holding out your hand. You can avoid doing that. And online payments is one of the main ways of doing that, especially when you haven't got a reception desk to handle those kinds of things for you. So it's a really great way to actually make sure that you separate the clinical aspect of your relationship and the service provider and service user aspects of the relationship with your patients. I think it's really important. And one of the other things that online payments allows you to do as well is that when someone's paid, they put all their details in themselves, and then they'll get a receipt by email. And it saves you drawing up invoices. It saves you, sending out receipts, all the sorts of stuff like that you might have to do because it's done for you, essentially. And so the way we do it in Medesk essentially is that we add the deposit screen at the end of the consultation booking process, and it offers the patient a chance to either pay a prepayment or the full amount. You can, of course, force them to pay the full amount or force them to pay a percentage or a fixed value. It's up to you, but we try and make it flexible if it makes sense to do so. And of course, then all they have to do is put in their cardholder name, put the billing email, enter their long card number, security code, expiry number, and so on. And that's all there is to it. Our payment processor, which is Stripe at the moment, will then send everything out to the patient. It'll obviously go into your account, and then the appointment is booked. And the benefit of someone having actually paid for the appointment is that you can safely put it in your schedule. Even if they don't turn up, at least you've covered your overheads, and you can proceed that way. Ideally, they will turn up, but it just means that it's not the end of the world if some people don't. And what we also do to kind of avoid that transactional nature of the relationship clouding anything else is allowing people to pay via the patient portal. So essentially, someone will log in with their mobile phone number and a one-time password, and they can actually pay the remainder of their appointment fee online. So you can easily send that after the appointment and give them a link to use, rather than, as I say, getting the card machine out, holding your hand out, and then saying, right, pay up. It's much nicer for the patients, and it's easier for you in terms of the financial document handling as well. And so one of the main things that the sort of lockdown, when it first happened last March, one of the first things that came about was, of course, a massive change in workflow and workload and how things were done. And I find that that's still having some degree of effect as people try and get back to normal and things take a step back and all sorts of changing variables are going on. And I found that the one main thing is that actually it's not that easy to fit things into an established workflow that you've always had. It's not that easy to completely overhaul the way you do things, but there are things you can do to make that easier on yourselves. So I wonder if you could think of any one thing that was most problematic about adding telemedicine to your normal workflow, what would that have been? Or what was it? And do you still struggle with that? Okay, we'll work through some of these answers as we go along. And so Stephanie Goodwin says, poor connection sometimes, patients sometimes find instructions confusing. So Stephanie, is that a poor connection on the patient's side, or is it consistently something on your end? Naturally, your end will be easy to fix. But yeah, good to know which way around it is. Yep. So Stephanie Toogood says, I'm only doing video sessions at the moment and seeing fewer clients than usual, so no issues. Okay. County Physio says, as I probably would have expected, to be honest, 99% of clients still request face-to-face, and those who accepted online consultations felt they weren't good value and didn't rebook. Now, of course, with physiotherapy, it's obviously in the name, it's a very physical specialty. So, of course, helping patients to essentially provide that therapy to themselves in some way is obviously going to be incredibly difficult. So yeah, I mean, I would say that telemedicine in the case of physiotherapy is maybe good for initial consultations, and then you can actually book them in with a specific physiotherapist for a given problem. But of course, it's all about finding out what people's expectations are and what they actually hope to get out of that first consultation. So if you make it clear it's kind of a fact-finding session and that they will then go on to see someone, that you probably have more success with it, I'd say. Gina says, parents often prefer telephone consultation rather than Zoom, etc. Yeah, so I mean, in Gina's case, I guess, yeah, I mean, in terms of when you're talking about someone else, and especially if you're working in neurology or psychology, those kinds of fields, there's not necessarily any benefit to having the video connection active, but at the same time, there is an argument for using the tools of telemedicine, but just disabling the video. You easily use the link as a sort of as a phone call link instead. And what that actually enables you to do then is avoid doing things like giving out your mobile number and that kind of thing, which you may not want to do. In terms of the rest of the chat, so Eastbourne Neurophysiotherapy Service says a good compromise and good results. Good to hear. County Physio says a lot of the older clients can't cope with technology. Yeah, so I mean, this can be the case. I mean, the older someone is, the more likely they are to be struggling with that. It's not a guarantee. Some people have said that too, got quite offended, I must say. But yeah, it's obviously there is a certain trend there, of course. I would say over time that problem is going to be decreasing in the sense that the average level of technological ability or usage of IT, that kind of thing, is obviously going to go up in the average person. But we're obviously talking decades here. We're not talking like 6 months for everyone to become suddenly computer whizzes or something. So in the case of older people, you could still use phone calls and stuff like that, and actually using all these tools I've talked about. So online booking, prepayment, stuff like that. They're all still pertinent and still relevant to this kind of thing. The difference is simply that you wouldn't say, here's a link and here's let's go on a video. You'd say, I'm going to call you from this number on the number that you've given me at this time and date, and then you go and do it. The benefit of that actually as well can be that you're the one doing the call, so therefore you're chasing them essentially. So you haven't got to worry about whether will they turn up, won't they turn up, because you're the one who's actually proactively going after them. And Beckington Physiotherapy have said, I've been surprised by how many older patients have easily accessed Zoom and other remote platforms. And yeah, that's really what I'm saying, is that although the trend clearly is that the older you are, the less likely you are to be IT proficient, it's by no means a fact that any given older person will be worse. I can speak from personal experience as well as professional that I know plenty of older people who are far more proficient in IT, and even if it's just clicking on a Zoom call, than many other younger people that I would have thought would know more. So yeah, it's no real guarantee that your patients will be this way if they're this age or that way if they're that age. It can give you an idea, make an educated guess, or you can make certain reasonably informed assumptions, but it's no guarantee, which is why it's still worth doing. Sarah Landon says, we don't use video consultations yet, but one thing I think will be difficult is seeing their scalp up close and not being able to look at their follicles. Touching and being close is very revealing. Yes, so if you're dealing with trichology, with hair loss, those kinds of things, seeing the scalp properly is, pretty much mandatory, really. It's obligatory. Makes perfect sense. I think that in the case of those kinds of specialties, again, it's like physiotherapy in the sense that it may well be worth having that initial discussion. You can easily still take a history, do a case history and actually understand what's going on. And then from there, arrange what to do next. It may be that even in person, all you would do is give them a certain therapy or certain medication at that point. Or it may be that you would actually still book up a next session for treatment, which could be an in-person treatment. So you can really still use telemedicine and phone calls as a kind of a validation call, a discovery call, triage, whatever you want to call it. It's a way to help you make sure that people are, suited for what you're doing and that they're willing to proceed and that they're able to proceed. And it is an opportunity to provide still some degree of value and even just reassurance to the person that they've come to the right place. So it's not what I suppose what I'm saying here really is that telemedicine and phone calls and those kinds of things are not a replacement for all physical consultations. They're often a good adjunct, and they're a part of the puzzle, but I wouldn't say that they would completely replace anything. So if you are trying to fit things into your work, there are a couple of points that we've really found that help. And one of those things is actually setting a dedicated time for video calls. So one of the biggest struggles people have had that I've noticed is when you're doing all sorts of different types of consultations, all jumbled up all throughout the week, you it's really very draining mentally, because you have to constantly sort of switch hats as you go through the day, and it's quite hard. It does take its toll after a while. So what I would say is, and this goes back to what I said about online booking as well, and making sure that you're available only in certain periods when you're happy to be, and you don't just, outright display your entire calendar. And that is that if you put all the video calls, all the times you're happy to take video calls in one place, then you will find that it's a lot easier to do, because you kind of get into a flow. The first one might be a bit, you might not feel quite right, but as you go through them, you kind of get into it, and you adapt quite quickly. So it is amazing how quickly people adapt to things. And so, I found that even in things like hosting these sessions, in that, when you first sort of say hello to people, you don't really know what to expect. You kind of, you're just there introducing yourself, the topic, and so on. But actually, you find as you get into the flow of things just naturally proceed. And it's the same in any kind of situation where you're communicating, when you're giving information out, when you're expecting a response from other people. It applies there as well. So I'd say, for example, set a morning for the video, and then do the rest of your work in the afternoon, or vice versa. But don't have it jumbled up, because it just causes chaos in the end. And one of the things I mentioned earlier that I'm really pretty pleased about that we have is the ability to convert bookings just by clicking a button. So if you have made a physical booking that ends up having to be a telemedicine call, or vice versa, there's no reason to rebook it. You don't have to delete it, change everything. All you do in Medesk actually is just click a button. So you pretty much click the online consultation button to yes or back to no, and then the link will either appear or disappear. And then the patient will get a message, so either by text or by email, depends what you want, saying, you've now got an online consultation, this is the link. Or you've now got a physical booking, because that's more appropriate, here's the time and date and address. So actually it enables you to quickly switch between those things back and forth. And again, like I said earlier, it's a really, really good way to actually save yourself from losing out completely. So if a patient calls you up in the morning, says, well, actually, I don't think I can visit, I've got a bit of a sore throat, or maybe I've lost a sense of smell, something like that, might think they've got coronavirus. But actually your specialty is not so related to those kind of symptoms that they no longer need your services. It might be that they still want to hear from their physiotherapist. They might still want you to talk about their problem. If it's mental health in particular, they're still going to want your services. So all you have to do really is say, well, okay, let's turn it into an online consultation. You're going to get a message shortly, hit with your link. Let's do it, and click the button, off it goes, and there you're done. So it really, really, really saves you bacon sometimes. And what we do in Medesk essentially is that we combine all the telemedicine approach with the normal booking approach that we take, and the normal diary and schedule and things we use, and of course the EHR. So what the telemedicine does is it tacks on a couple of different options beneath the normal booking screen options. So instead of just beginning your appointment, you'd actually connect to the patient first, make sure it's all connected up, and only then would you begin and start your notes, if you even write them at the same time as the consultation when you're doing telemedicine. And so it's all very, very nicely integrated, and it means you don't have to go searching for links. You don't have to go opening external diaries or anything like that. You can pretty much just click a button and get started. And again, it's all about not just adapting, what you're kind of doing there, but it's all about kind of getting that different sort of mentality, that different. So it's kind of like working from home, I guess, in that if you have to work from home, you need to separate that home life from that work life in order to optimize both. Because when you have each of them bleeding into the other, it just causes problems for you. Work often in my case the work wins, but it can happen that one wins over the other, and then both are it's detrimental to both. So what I would say is that if possible, have some kind of designated space. It's all the same sort of remote working kind of tips you probably get emails about from LinkedIn and all sorts over the past few months. But it's all about taking that space for yourself, saying that's my work area. That's where I do things. And simple changes like that. Firstly, they help your mindset, they help you understand, and help you kind of separate those things as I've described. But also, it does create a more professional impression for the patients as well. Because although they might be aware you're perhaps working from home, they don't necessarily want to see that you're sat on the sofa. They don't want to see that you're actually at home. They'd rather see like a blank background, or maybe even your logo in the background, anything like that. Give a more professional impression. And one of the main problems you're going to have, of course, is that you no longer might have your team to hand. Either because you're in the clinic and they're not, because they're furloughed or not working or ill or whatever, or because you are at home and they're at home. Or maybe you're at home and they're in the clinic. Either way, there's that bit of that problem where delegating things to people and having them delegate things to you becomes a little more troublesome. So what we do in Medesk is that we have linked up all the task delegation aspect of our tools with the appointments, booking, with the patient record, and also as part of a standalone task module as well. So what it means is that when the patients make a booking, you get a task, and you get an email alert if you want one as well. And then you get a list of all their responses to the questionnaire you would have put up for the online booking. If one of your colleagues has given you a task, to do, so if you're an admin team member, for example, if they've asked you to print something out for them and send it out to the patient by post, that would be done straight through here, because it would be pertinent to the patient but also the appointment. And also, likewise, if the patient has rung up asking for a repeat prescription, actually all you'd need to do is set a task to the last clinician who issued that particular prescription, and they would see that it's related to a certain patient and a certain appointment if you attach it at that point as well. And then they would know what to prescribe, and then they could get that sorted. So this really enables you to kind of stop the troubles of working remotely, working apart from other people, and just allows you to kind of streamline everything and get things working as they were. And one of the great benefits of doing it even after all this lockdown business is over and life eventually returns back to normal is that you'll be able to essentially use it as a kind of auditing tool. You better see how many tasks people are doing, who's doing what, and of course you better have a log of how things are going. You can use it for comments and going back and forth, using it for things like MDTs actually, if they're just sort of informal discussions rather than face-to-face conferences or anything like that. We have a question from Stephanie Goodwin in the chat, asking if our system will work with something she's already using. I'm just going to have a look. Okay, so essentially what we do will probably supersede that rather than work alongside with it. So it would definitely worth having a discussion with my colleague Christine, either after the end of this webinar, which will end shortly, or she can give you a call, and then you can weigh up the pros and cons of us versus them and make a decision that way. I'd advise that. Okay, so again, delegating management. And one of the things I've really noticed about paperwork is that it's when the burden's on you to do the paperwork instead of the admin team because everything's all gone a bit crazy, actually what we do is we've templated as much of it as possible. So essentially all you've got to do is click a few buttons, type in the most basic of information, and the platform will develop the correct notes and correct documents for you. So essentially, to write a prescription, all you'd need to do is choose a drug from our BNF database, tell the patient how to take it, and then say how much how much you're going to prescribe. So a month's worth, 3 months worth, whatever it is. And actually, that will, in one click, generate a prescription. This is just purely an example on the right-hand side of this screen. It doesn't have to look like this. It's just one I made for the sake of it, just for our demo clinic. And Christine probably still uses some form of this when she shows that off in her product demos. And so essentially what we do is you type in a bit of information in your template. Medesk pulls all the information from the patient record, from the EHR, and adds it all together in the right place so that you end up with a document that you have to do very little to achieve. It works the same way with referral letters, with GP letters, with electronic lab requests, all those kinds of things. It's all just a case of minimizing the amount of information you have to put in. And that's half the trouble, really. I mean, I don't know how you feel about it, but for me, paperwork is just hassle. It's obviously essential and necessary a lot of the time, but the way in which we do things and the fact that we do them, you know, it doesn't have to be that it's laborious to do something. You know, even if it's sort of a necessary evil, you have to do it. There's no reason to make it hard on yourself. And one of the big problems I find about telemedicine is actually keeping people engaged, because it's really hard when people, first of all, they're not sure what to expect. They're not sure if they understand the value of something. They may just be doing it just for the sake of it because there's no other option. And so you really got your work cut out for you in regards to making sure they understand and they keep engaged. And so there's lots of different stuff we do. And one of the main things is actually automated messaging. So whenever a booking's made, we automatically send out a text message and an email with confirmation, and it contains all sorts of information depending on what you want. It can be related to the individual service they've booked. It can be a bit different if they're under 18, for example. It might be addressed to the parents. You know, it can be in a different language if their language is not English. There's lots and lots of different bespoke content you can put together, and that will automatically go out depending on you know, who the patient is and what they've been marked as in terms of you know, their particular characteristics and what they expect and the appointment they've booked. And that goes along with reminders as well. And what we do is we actually set 2 different reminder schedules for both in-person consultations and telemedicine. And what we found is that when you've got in-person consultations, you can get away with, say, reminding someone a week before and a day before, for the sake of argument. But in the case of telemedicine, you can actually remind them, in addition to that, also like an hour before, just to make sure that they are, you know, they're able to, you know, sit down where they intended to, you know, even make themselves a cup of tea or something, or even get back home if they've gone out to the shop or something like that. You know, it just makes sure that they have that time, because it's not like they have to travel across the city or the country to get to you for that appointment. So they'd need that extra day's notice to make travel plans. They only have to find somewhere where it's quiet, or they can put the video on or answer a phone call. And since we're locked down, they should be mostly at home anyway. So, or unless they have to work outside of home. And yeah, like I did for you. Yeah. That's pretty much right. Yeah. Not me personally, must be honest. It was one of my colleagues, but yeah, may well have been in my name. But yeah, we do practice what we preach. And in fact, one of the interesting things I really like is that my colleague Christine, when she does the product demos for Medesk, she actually uses our telemedicine platform as a way to show it off. So I thought that was pretty clever. Yeah, so I mean, this is just a little bit of a screenshot as to what I've been talking about, really. You can easily configure different messages in advance, and send links out and send different content for various different services. So, I mean, it could be just a link, it could be your address, it could be the cost, it could be the duration. It could be information about the service if they're going in for a scan, for example. It could be to make sure they empty their bladder. It could be if you're doing like an oral glucose tolerance test or something like that. It could be, to make them aware of that that's going to actually happen. No one wants to drink, a pint of Lucozade, sort of warned, I don't think. And same going with things like cortisol, stuff like that. If there are tests that need to be done at a certain time, there needs to be certain conditions. It's good for people to know about that in advance. Because the last thing you want to do is actually have someone not comply simply because you didn't tell them. And one of the things I would say is, as well as purely reminders, it's often worth kind of triggering alerts as the appointment's about to happen as well. And I think that our webinar alerts do that as well, Sarah. In that when I start the webinar, I think it does send out a bit something of a message if you're not already here. And so the idea is essentially you click a button in Medesk and it sends out an alert straight to the patient via text saying your consultation is meant to be now at this time on this date. Here's your link if you somehow lost it or you're thinking not of attending. And what it does is it actually rescues that situation. It means that if they were otherwise just going to no-show, then it just gives them that last sort of push from you that actually you're kind of waiting for them. And it does tend to work. And so the last thing I'm going to discuss today, I realize we've run over a little bit, is the idea of cancellations and how we can kind of avoid those and how we can learn quickly from what's going on and try and nip problems in the bud. So before we start, for how many of you are cancellations an actual problem? And what have you been trying to do about them in order to stop them happening? Okay, so County Physio says, not since I email 2 to 3 days in advance. And do you do that manually, or is it something that gets sort of sent out automatically? Stephanie says, we'd send out a text reminder the day before and charge if they cancel within 24 hours. Yeah, that's pretty much what I'd recommend, really. I mean, I can't say any better than that. What we tend to do is we say to the client, set your last reminder for this date or this amount of time before the appointment, then have your cancellation policy maybe the day after that or slightly after that. So for example, give them 3 days, a 3-day reminder in advance and have your cancellation policy be 24 or 48 hours. So at least it gives them that last notification before they accidentally, cause themselves to have to pay you. And Elaine says the only cancellations recently have been COVID related. Yes, so that's one of the things I was going to talk about actually, is that when you're marking your cancellations, it's always important to categorize them. And actually, if you can look at why things happen, you can look at whether they're problems you actually can solve or problems that you just have to work around. And COVID is one of those things. You can hardly, cure the disease and then have them able to travel and, it being, even legal for them to travel in the matter of that, the time between the reminder and the appointment or when they've cancelled or wanted to cancel the appointment. So there are cases where I'd say if you make the distinction between good cancellations and bad cancellations, much like good debt and bad debt, there are sort of certain cases where it's just unavoidable. It's part of life, and you just have to deal with it. And other cases where it just shouldn't happen, and you need to find out why. So Beckington Physiotherapy says, I don't get many as I already send out the link 5 minutes before the appointment. So that's perfect. I mean, that's pretty much what we'd say to do, really, is that if it looks like someone's going to no-show, send a link out. It might be even send it out anyway 5 minutes before, or it might be just send it out on the dot, on the hour when they're supposed to turn up. Either way, it's good practice. Gina says, I tried to gain rapport on my discovery call. Yeah, so that's, of course, one of the things as well. It's all about demonstrating that value in the initial call. It's all about making the patient understand why they need you. And it's not just a case of, pushing them into it by taking a payment or just, bugging them with reminders. It is about actually making them understand they need it as well. County Physio says, I do it myself, have our own templates. That's great. So the templated approach is kind of what I've been talking about. But what I would say is that I don't know how it is for you, but for a lot of people, I find that even if they've got templates, they actually have to send out a lot of messages. And it just becomes a task that, although it might not take too long, it's not the most exciting task, and it doesn't need to be done one by one, really. And what we do actually is, based on the type of patient, based on the type of appointment, type of consultation, we do actually then, the templates automatically change according to that. So you could actually have that automated function and that customizability that you clearly value all in one thing. And so when it comes to solving cancellation problems, the first thing to do is actually track the problem in the first place. So if you're actually tracking the amount of cancellations you get, so both the absolute numbers, the percentage of the total appointments you're getting, and also the rate of change over time, you can then really get an understanding of a global sort of picture of where you stand. So if you include DNAs in that as well as just cancellations, of course, that's good too. Because all the DNA really is essentially a cancellation they haven't told you about. It's ultimately the same thing. So the quickest way we do it is sort of a dashboard, a donut chart. Just gives you an idea of whether it's something you want to look into, and then you can go deeper into the analytics and look. But of course, to actually dig into things further and not just see that someone's cancelled, you really want to know why. And again, it goes back to what I said about good reasons and bad. If it's something you can solve, like it's a bad reason, in other words, maybe they say you're too expensive, maybe they say they went elsewhere, maybe they say that they didn't like the clinician they spoke to last time, all sorts of stuff like that. What you can do is you can understand whether it's something you can solve, and if you can solve it, you go ahead and do so, and then you track the change. So you may assign that patient to someone else. If it keeps happening with a given clinician, you may actually want to talk to them about it, and take action accordingly. It might be due to a certain time of day. It might be due to where they're finding you in the first place. There are lots and lots of different reasons. So it could be that all the people who come from Facebook are unreliable prospective patients and don't turn up. It could be that everyone booking a certain service isn't serious about it. It could be everyone who essentially makes a booking in the late evening never turns up because they just don't want to. Then there are lots and lots of different reasons, and the idea is to actually pick up on them, because it's not a problem in to change something if you at least know what to change. And so that does bring me to the end. I've run over a little bit, probably asked too many questions as usual. But I do hope that you enjoyed this webinar. We have a short section from Christine, who's just going to explain a bit more about Medesk itself and give the opportunity to get in touch with her. So she'll only need a couple of minutes to do that. It's well worth sticking around. She's got a lot to say, and I'm sure you'll learn a lot from even just this few minutes. And we are going to stick around for some questions at the end as well. So Christine, if you are here, please do feel free to join the presentation. There, she's coming now. Good.
Hi.
Yep, audio is all good, video is good.
All right, okay, let me just quickly share my screen. You have covered quite a few features today, so I'm not going to take too long. Just cover briefly a few things that I wanted to make sure that our attendees are aware of, what we actually have in Medesk. And if they're interested, or if you are interested, basically, just feel free to get in touch with us or leave a request on our website. So basically what I wanted to cover today is a little bit more general information about Medesk, and if you're, again, would find it useful to be integrated within your workflow in the clinic. Basically, the platform Medesk itself is web browser based, it's cloud based, it can be accessed from any kind of device, whether it's a mobile phone or a tablet or your stationary computer or laptop. It adjusts itself to the size of the screen, making it look nice and neat and comfortable to use. It is, of course, GDPR compliant too. So we've got around 600, 700 clinics from all different kind of areas in the healthcare, and we have gathered quite a lot of experience with helping to tailor the product to actually fit the clinic's daily routine and support, instead of actually, well, bringing more issues than it was before you actually have started using the platform or any other softwares. Mike has pretty much covered the ability to integrate the online booking or just the collection of the patient records, patients' requests and their backgrounds, medical backgrounds and information from them via pre-assessment questionnaires, as in you don't really have to share any of your timetable or schedule, just collect the preferred date and time to be contacted. Now, again, something that we haven't mentioned, you can attach the booking links and collect the bookings or requests from all different kind of media channels. And if you promote your clinic, say on Instagram or Facebook, you can place the booking link, and when the requests come through, the platform basically instantly tells you where the patient has come from. So you can build a report based on the demographics or kind of see what targets audience attracts that particular media channel, and you can adapt your marketing campaigns a little bit more and a little bit better and more efficiently for each media channels that you use and that you're present on as a clinic. So we accept payments via the platform. Again, that has been pretty much covered, so you're not going to focus too much on that. We have plenty of experience in creating the most comfortable to use and time-saving templates for the consultation notes. We usually make them from scratch or rebuild the ones that you are used to using, or actually making them a little bit more comfortable to use and a little bit more quicker to fill out, to have actually more face-to-face time with the patient. And you can make use of our BNF, BNF database integrated as a part of the platform. What it actually does, it allows you to search for the medication. It shows the list of the active elements used in this medication and the different generics, along with the dosages, along with the types of the drug, whether it's a tablet or solution. The same approach is used with the ICD-10 database. So you type a few letters of the diagnosis and it gives you the whole list of the relevant and related ones. Both databases are connected to the NICE guidelines website, leading you to the relevant page of that website with the relevant research and the treatment plans if needed. All of the printable documents, of course, will be tailored for your clinic, for each practitioner, for each service that you provide. We try and, again, go for the more templated approach that still can be customized and tailored for each patient. There is always going to be a free writing section where you can throw in more personal bits for the patient, yet still not spend too much time on copying and pasting or typing something in manually. The platform allows to export any of the printable documents like invoices, reports, consultation notes, prescriptions, anything that you need to somehow pass over to your patient or to your partner. As well as that, it allows you to upload any kind of documents, pictures, scans, voice recordings to the health record of each patient, or actually attach them to each appointment so you can get back to it and review it from your phone or from your tablet. It's just, the slide shows how it's done. It's like literally me recording my phone and just smushing it into this little demo. The way we try and help you build the reporting, the analytics tool itself is very flexible in Medesk. It literally allows you to pinpoint different pieces of data, bring them all together. It pretty much works as an Excel, but you don't really have to know the formulas for getting the result that you need. So it will help you to create any kind of report, given that you provided the data in the platform. Michael has covered the reminders, so I'm not going to repeat ourselves here. You can use the integration with TDL that we have, sending orders, receiving the results directly from and to the platform. We have got the stock control feature, allowing you to manage your inventory levels. This is my silly GIF that just shows the workflow of how the click of a button takes you to the video consultation room, and that's me being just silly, joining in from my phone and from my laptop. That's all from me in general. Don't want to waste any longer time of yours. Please feel free to reach out to myself or to Michael if you have any questions related to the masterclass or related to the platform. If you would like to receive a video recording, please feel free to actually as well check out our website. We've got the pricing section there with the calculator that you can literally play with and get the quote. Starts with the £19 per month, just in case you didn't notice. But again, that's it from me. Thank you so much for attending and actively participating today in our masterclass. Thank you, Michael, for being as awesome as you always are. And yeah, have a good rest of your day and evening. Good luck. I'm looking forward to hearing from any of you if you're interested in knowing more, of course. And I kinda have to battle as usual with the technology because it hates me. Woo, Treepy, oh my god. How do I stop this?
We can probably kick you out. Let's just check.
Oh yes, please do.
Yeah,